Well, reclassifying cannabis from a Schedule 1 to a Schedule 3 drug could expand medical marijuana and CBD research, giving doctors and patients better data.
It's an honor to do this.
President Donald Trump signing an executive order to move cannabis from a Schedule 1 drug alongside heroin to a Schedule 3 controlled substance like Tylenol with codeine, testosterone, and ketamine. Tonight, I spoke with legal analyst Dan Eaton, who notes Schedule 1 drugs have no accepted medical use and a high risk of abuse. Meanwhile, Schedule 3 drugs are recognized as having medical value and a lower addiction risk, a shift that opens the door to more medical research.
The purpose of this is to ease the way towards more research on the medicinal usages of marijuana and ultimately to allow for its greater use.
This executive order does not decriminalize cannabis. Meanwhile, critics of this move could argue the process could be flawed.
Opponents will probably argue that that the process through which the president is going about this, and maybe even the way the DEA moves this process along, is somehow defective.
Cannabis journalist and San Diego State University professor Jackie Bryant says the biggest beneficiaries could be large cannabis companies.
Truthfully, it doesn't change much for the average person. There's no justice provisions in here, equity provisions. There's nothing that would open it up or make it more accessible than it already is for the average consumer.
Bryant notes reclassification could remove a federal tax penalty currently hurting the industry.
The cannabis industry in California is very, very economically strained, and so making it easier for them to do business, it should be better longer term for the health of the overall market.
And Eaton says that this could take about a year to take effect, with several steps still ahead. Esmeralda Perez, CBS 8.